So when something happens to your loved one, we can tell you from experience that the first thing that's going to happen is you're going to be incredibly overwhelmed. At the phone call or the notification that your loved one has fallen ill or whatever. Um, and my thought is just acknowledge the fact that it's not going to be easy. Wrestle with the idea of what's wrong with them. But as things unfold, you'll be able to shift to what we would say would be a fairly decent plan in going forward, and that is once you know what's wrong, then shift to the needs. What is it that your loved one needs? And I would encourage you during the process to gravitate toward the medical professionals that you feel most closest to, the ones that you can trust. There will be some that will come and go, you won't spend as much time with, but the primary healthcare providers, the one that you spend the most time with, you'll develop relationships with, and you can seek advice for them. What does mom or what does dad really need? And once you determine those needs, you can also use these same people and additional folks to determine, well, where do we go from here? Based on the needs, what kind of care do they really need? And you seek out the best professionals that will give you the care for your mom and dad as best as possible. Not that it's easy, but if you focus on the need, seek out the people who can give you the best advice, then you can best decide where to go from there. Another thing is making sure that the caregiving team that you put together are collaborative. Make sure that they will communicate with each other, they will talk with each other so that treatments don't crash in terms of medication prescriptions and things of that nature. So just make sure that the team is talking to one another and building a plan together. And then the last thing I would encourage people to do, that if you don't already have it, is work on your advanced directives in terms of your directives to your physicians, your medical power of attorney, and do not resuscitate. So in the state of Texas, those are the three documents that you need for people to carry out care in a healthcare facility. The directive to physicians and other parties will advise the healthcare team of what your loved one's wishes are. What do they want to do in certain conditions? The medical power of attorney will actually name a person to carry out those wishes, and there won't be any confusion as to who is in charge of your loved one's care. And then the do not resuscitate is important to carry out the wishes in certain situations, whether the situation is terminal or, let's say for instance, your loved one's heart stops beating, they stop breathing, then you know what their wishes are under those certain conditions. So in our estimation, once these events occur, it's chaotic, it's really emotional, it's really difficult, but if you focus on needs, focus on the people who can help you plan the care following the needs, and then have your advanced directives in order, then you'll be in great shape to carry out your wishes of your loved one. And again, my name is Steve Watley with Home Rule Senior Care of Collin County.